there's a lot of stigma still associated with HIV within the African Caribbean Black community. So having various options for testing, I think, is really important. It gives people a lot of choice around the way in which they want to interact and engage with HIV testing. There's also the piece around it being, having a level of privacy that you can control, around it being anonymous. Those things are really important. It's really about folks being able to have their own agency and autonomy in their engagement with HIV self-testing, or just testing in general. There's been a lot of mistrust within the community when it comes to dealing with healthcare institutions, the institutionalized racism that exists, that creates just challenges around accessing, accessible testing for our community.
We are trying to do testing to get to zero, of course. We're working to support the 10% of people who are estimated in Canada to be living with HIV who don't know their status. We assume that those people are very marginalized because, unfortunately, Canada still has one of the highest rates of HIV criminalization. We have to be very careful when we're engaging with people to make sure we're offering them a lot of autonomy and independence in knowing their status and making sure that they're not getting policed as a result of getting engaged in healthcare behavior that's supposed to benefit them and their well-being.
Comment on voit le système médical comme la norme pour aller faire un dépistage, mais que ça répond pas aux besoins de tout le monde, puis il y a des gens vraiment qui ont besoin de plus de temps. Fait que c'est vraiment comme toute l'intervention avant et après qui fait en sorte que la personne va réaliser un dépistage au final. Puis ça peut vraiment donner la liberté à quelqu'un de reprendre sa sexualité en main, puis d'avoir plus de plaisir, puis moins de risques. Puis c'est vraiment ça qu'on veut.